the problem with STDs is that a lot of my patients and a lot of people don't want to talk about it. Just like any other disease, it is a disease which needs to be discussed with your treating clinician. You can be extremely open with them and they can help you out only when you give them the right kind of history, right?
How can technology be integrated into healthcare?
Okay, so there is a lot of hustle and bustle and talk about digital health nowadays. It is like the most upcoming thing, which is integration of technology into healthcare. May it be on a personal basis, may it be on a point of care diagnostics, may it be on a remote monitoring of patients. So I think I've almost enlisted everything about it. So like technology integration into healthcare is the future of healthcare. A recently launched scheme by Government of India, which is ABDHM, Ayushman Bharat Digital Health Mission. It also entails a lot of policies which govern digital ID of patients, which has health records, promotion of teleconsultation, which is again any person in a remote area of India can contact a doctor of their choice in the city of their choice, the specialty of their choice. So how is all this possible? Only through technology. So that's where we are headed. And I also feel that digital health is a component which, once integrated into your healthcare regime, empowers you about your own health. There are a lot of apps which are now available which can help you track your, literally everything. How many hours of sleep you got? Did you do your optimum physical exercise? Did you drink enough water? Did you take the optimum calories for those days? Did you take your multivitamins? Did you take your medications for any illness that you have? Depending upon how your glucose levels have been, it can moderate your diet, and all of that information is just available at a click. So this kind of access to awareness of your own health wasn't really possible a few years back. It is only because of that digital component into the healthcare services that we can be so empowered with our own health.
Absolutely, very rightly said. Now, even with Redcliffe Labs, we have telemedicine consultations.
Right.
There are doctors who are just a click away. You can consult them over telephones. They'll advise you about the right measures to be taken, and you can download your reports through our app. You can consult a doctor after your reports have arrived or you've received your reports.
Yeah.
You can easily consult them. These things were not there 10 years back or 20 years back.
Absolutely. And also for, I think, point of care diagnostics, today I want to take any test I have in my mind. I don't have to go through that entire hassle of first going to a clinician, getting the test righted and taking the test at the similar facility. You could have gone to your clinician earlier, and whatever test they have recommended, it's all just at a click away on probably your
you can easily
dashboard.
book.
Yeah, and
tests.
You have home collection, you have digital reports. It's just so less hassle because of digital integration into the healthcare component.
Doctor, there are certain SDG goals, Sustainable Development Goals. How do you think those goals can help empower women to take care of themselves?
Okay, I think that's a very broad question that you have asked me. But to answer to that, I think as a woman, as a doctor, and also someone who believes in the concept, we all have to, believes in the concept of Sustainable Development Goals, I think access to right practices and also right information about reproductive health, most importantly, because that is our job. That is a biological need of the society and a biological task which has been given to us. So giving the right information about reproductive health to women, educating women, overall education of women, and making essential healthcare services, which mostly should entail MCH, which is maternal and child health services, which is ANC checkup, blood tests, and vaccination and all of that, accessible to women is the best way to empower them.
What are the barriers faced by women in accessing healthcare?
Okay, I think it is a very subjective question, but if I speak of my community here, we as women generally tend to underestimate our symptoms, I would feel. This has been my observation as a doctor that, since our body is a little complex as compared to the male body, our body goes through cyclical hormonal changes every month, that we are so used to so many changes that any small change, if it occurs, we don't really tend to pinpoint it, Like there have been times when patients have come to me with this full-fledged breast tumors, and then I would ask them that why could you not pick it up when you felt the lump before? So they just thought that it was just any other thing, a very small thing which does not probably require medical attention. And now when it has become like a full-fledged cancer, it is difficult for doctors also to get them back to, you know, a non-cancerous state, and also difficult for them to go through all of that treatment. So I think picking your symptoms is very important, ladies. Anytime you feel that there is a change in your body which requires attention, if it is grabbing your attention, it might also require medical attention. So women should always not underplay, not underestimate the symptoms that are going on in their body, anything for that matter which is going on in the body, and not also rely on, you know, some friend or someone who's told them, oh, this really happens, this is perfectly normal. It might not be normal. I mean, a doctor is probably now just a call away. Just let the right person take that call for you.
There's a lot of hesitance. That is why people do not go to a doctor at the first go, or when they feel something unusual with their body, they neglect it, thinking because there are a lot of stigmas associated with it. Coming to that, doctor, how do cultural and social norms or beliefs that are still prevailing in our society impact women's behavior towards their health?
Okay, so see, as far as cultural practices and beliefs go, it is not only the Indian society, it is societies across the world which have certain cultural and beliefs which, which governs their healthcare seeking behavior. There is a term called healthcare seeking behavior which really governs all of that. So, for example, I would not like to name the country. There's a particular country in Europe where they don't really believe in institutional births. They all want to give water births. But I, as a doctor, I understand that what is the importance of an institutional delivery. But since they're for generations, regardless of their financial, economic, educational status, they have just practiced one practice, they go on and about it, right? So if something has been going on in your community, in your society, the general word which is there, it does affect your health seeking behavior. So if I suppose, mostly, you know, suppose I get a mental illness, I get anxiety very often. So if I'm just going to ask my peers about it in whatever setting I live in, they will be like, it'll settle on its own. But no, it requires medical attention. Similarly, a lot of issues with women's body, you know, say for example, a woman is bleeding for, you know, 7-8 days during her menstrual cycles. So she might be advised by some dadima in her house that it's perfectly normal, you're supposed to bleed, but that's an abnormal length of a cycle. It can lead to a lot of further complications in your body. It can lead to blood loss, and it can lead and render you to anemia, and there could actually be an underlying pathology which, because of which it is happening, and it needs to be picked. So yes, there are beliefs, they govern healthcare behavior, but also we need to believe in science. It has advanced, it is not some mumbo jumbo. There are people who are reading, and we all are empowered with a lot of scientific evidence-based knowledge. So you should always consider taking an expert's advice. Yeah. So for example, there are a lot of people still in India when newborn babies are born. So that kajal is put in their eyes, and that kajal is laden with lead, and lead can lead to lead toxicity in that newborn's, you know, body. So when patients come to me for any other illness of their child, maybe he's having a cold or a cough, I always take the opportunity of telling them that you want to save your child from evil eye, from nazar, just put the kajal on the entire face, do whatever, just don't put it in the child's eyes because it has direct access to your body. Okay. It can lead to lead toxicity. So now only I can tell them this, but if they do not do it in their community, they might probably be outcast or cornered because that's the norm. But that norm might not be the best thing for your body or for your, you know, relative's body.
There are certain practices that are still ongoing, and that is due to lack of awareness and knowledge that people are continuing with those norms. Absolutely. Which are hindering their health.
Yeah, and most of them govern menstrual health, I would say. Yeah. Women are still using the same cloth, rewashing it, which are very unhygienic and unsafe practices. And they are still not being allowed in temples and being cornered in their own houses. So all these myths doesn't really make sense. It's not going to give them any good health benefit also. you should use a sanitary napkin, and then there are a lot of efforts which are made to promote such correct practices by our government, by doctors, by people like you. So we should comply to all of that.
True. Thank you so much that you've taken time out to come and empower people with good health through your knowledge.
Thank you so much.
Healthy India की